Hello, Bay Area. You are listening to Radio Mirchi 1310 AM and your one and only RJ Mirchita. You may be wondering, "Ke, where are you, Mirchita? Hey, I'm nowhere." But you know that what's going to happen tonight? It's a very special show because we have four amazing orthopedic surgeons who are going to collaborate. I know. Curiosity is the mother of invention, right? Well, I was curious, so I connected these four guys and I was like, let's just do this. So we have this show. We are running 15 minutes late, but we are live and here, Pardafash. And that's why I'm here. So we have all doctors ready with me right now. We have Dr. Moda, who is going to lead this show. We have Dr. Kirat, who is in US. As you can see, it's like, oh, I've done so many surgeries that I'm just like so tired. But no, he still showed up. So I'm super excited. We have Dr. Kishore and we have Dr. Kalpesh. So I'm just gonna start the show with a lot of energy. And you know that today's topic is, Arey yaar, if you fall down, then doctor is gonna tell you, जाओ एक्सरे करी आओ मतलब कि जाओ जाके एक्सरे करो and in Punjabi I don't know but ओए एक्सरे करवा ले something like that, right? Well, whatever. So we are going to talk about x-rays. What are these different kind of procedures? Well, hip and knee transplant, well, sorry, not transplant, I would say surgeries, because I'm not good with that. And we have today amazing panel. So before going to any other things, I would like to tell one simple quote, which I loved it. I was just reading one fine day on the internet and I was like, well, I'm interested whether all these doctors, right, they talk a lot, they do these surgeries and stuff, but hey, is it gonna work or not? Half of the times people just tell me, oh, I got this surgery, and I'm like, oh, do you think it's gonna work? Do you trust this guy? I mean, as if like you're gonna marry this guy or not, right? So I'm like, I don't know if it's gonna work or not. But I was doing this amazing research, and I figured out that there is someone on this entire earth who is called the Miracle Man, and I'm like, who is this guy? But there are people like him, and his name is Morris Goodman. So he claims that he is the Miracle Man, and he says that he said that once you have your mind, you can put things back together again. Well, I kept on wondering, what is he trying to say? But do you know why he's called a Miracle Man? Because he recovered from a plane crash, which left him paralyzed, unable to move, unable to breathe, unable to talk or swallow anything. But even then, he survived so many surgeries, PTs, transplants, whatnot, right? So that's why he is called the Miracle Man. And today we have marvelous doctors with us who are going to share their stories. And he actually turned the greatest challenge of his life into greatest gift, right? So today we're going to do that too. Don't doubt. Let's just focus on what these doctors have to say today. And again, I want to emphasize that, did you know that a healthy mind leads to a healthy body, and vice versa? It's not just one way. Okay, oh, the doctor did the surgery, you're gonna be fine. Well, that's not gonna work, right? The doctor did the surgery, you have to take care of yourself and you have to train your brain so that you don't do any kind of drain. That's Mirchita's talk. But good morning, good evening if you're in Bay Area, and greetings to everybody who is watching us live right now on YouTube and Facebook. I'm gonna introduce Dr. Moda, who is the founder of Gokul Group of Hospitals, and Dr. Kishore Maheshwari. So let me introduce him. He's running private practice at Jamnagar, Gujarat, India since 1986. Well, I was not even born that time, huh? Okay. He's ex-assistant professor for ortho department for MP Shah Medical College, Jamnagar. He's past president of Gujarat Orthopedic Association 2007. Government of India patent holder of research instrument Maheshwari jig used in trio fractures. Like, I don't get this, but apne sir ne puchu ke what does this even mean, right? To like patent something in medicine. He has published articles in domestic as well as international journals like Lancet and others. And one more key thing, don't forget, he specializes in knee preservation surgery. Well, I used to preserve butterflies. I don't know what is knee preservation, but it's quite interesting. So it's called HTO. Then we have amazing Dr. Kalpesh Bajania. He is consultant spine surgeon currently working at Gokul Specialty Hospitals. Rajkot, Gujarat, India. He graduated with MBBS from Vijay Medical College in 2005 and MS Orthopedic from the same in 2009. He has conducted several operative complex surgeries, including cleft, oh my god, what is this? Microlumbar disectomy, microendoscopic disectomy, which are not just at one hospital, but guys, several hospitals. એટલે બહુ જ બધી hospitals માં, okay? बहुत सारी vatiya, I don't know, something. I'm trying to speak all three languages. I'll try my best because we have doctors from different regions, obviously. It's a global show. So he has also published several research papers and attended so many conferences around the country. Next, we have Dr. Kirat Singh. Well, Dr. Kirat Singh is trained at Vanderbilt Medical Center, Nashville, in Tennessee, where he did his orthopedic surgery residency. He went to do 2 separate fellowships. Oh my God, when I think about one fellowship, I feel like, okay, I'm already feeling dizzy. So if someone has done 2 fellowships, I'm like, oh my God, that would be a great deal. It takes a lot of patience, isn't it? So he did 2 separate fellowships, one in orthopedic trauma and second in orthopedic joint replacement. I get almost scared with 2 fellowships. But he was hired at Emory after the joint fellowship, which he also did at Emory. He takes care of primary and complex hip and knee surgery in addition to upper and lower extremity trauma. So that's the introduction of doctors. And now I would invite Dr. Moda to share a few words about today's special show. And I'm super, super excited because we have different doctors. So Dr. Moda, over to you now.
Yeah. Good morning, listeners. And I will say a few words about Dr. Maheshwari more and Kalpesh also. Maheshwari is handling our Gokul Hospital at Jamnagar, and he is our partner there.
Okay.
So he is the one of the director of Gokul Hospital, and he is the part of Gokul Group of Hospital as well. So this is Dr. Kishore Maheshwari. Kishore Maheshwari is Marwadi, basically. So he knows 2-3 languages. So that is another thing about Kishore Maheshwari.
Okay.
Then about the Kalpesh. Kalpesh is working hard at Gokul Hospital. He does trauma also, as well as he is doing spine with us. We do microlumbar discectomy, endoscopic discectomy, then lumbar fusion, minimum invasive spine surgery, all type of surgeries he is doing. And most of the time, me and Kalpesh work together for the spine surgery. And we are enjoying it. I would like to tell Kirat, you might be surprised that in India it is 24/7. You are there for whole week.
Do you want to say? I'm asking him, do you want to make any comments about your fellowships? Because you have done 2 fellowships.
Fellowship is different, and the residency is totally different. You see, in residency, first year residency in India, orthoped surgeon lie on the bakra, benches. They don't have a time to go to his room. They work hard. They don't have a time to go for a breakfast or to go for a loo. So that is the residency, orthopedic residency, as well as neuro residency in India. They work very hard, and even if they have to go with their girlfriend, it's a hell of a problem. It's very difficult. And on the top of it, they work so hard, but on the top of it, they get fired from the boss that you are not working up to the mark.
Oh man,
so
it does happen
in India. Kisla.
I agree with Dr. Moda. It is very difficult to get time to sleep, to time to eat, even time to do the shaving. That's the residency what he explains.
Okay, guys, let's not scare the listeners, otherwise they're gonna run away. So let's start with the show, and with further ado, I would like to ask some questions.
Let us
First
start
of all,
with Kirat then.
yeah, that's what I want to talk to Dr. Kirat, and I want to ask him first to introduce or say something about him and what he does, and then we'll take the questions. Dr. Kirat, over to you.
Yeah, thank you for having me on the show. Again, we're very lucky to take care of people every day and have an incredible job, all of us on the screen. Nishita, thank you for putting this program on for folks to listen. Now, ultimately, I think for the audience, I just want to talk briefly about hip and knee arthritis and say that hip and knee pain, especially as you get older, is very common, and particularly in your 50s and 60s, the cushion inside the joint wears out. It's like
Mm-hmm.
tire on your car. So with time, it wears out, and then as the bones start to touch one another, people have pain, particularly
Mm-hmm.
with activity, so walking or hiking, biking, or whatever.
Mm-hmm.
And people ask, well, what kinds of treatment options are there in 2021? And
Mm-hmm.
the most effective treatment option, I always tell people, is to lower their weight, because it's a matter of physics. The less weight that you have on a frame, the less
Mm-hmm.
weight goes through a joint, and physics dictates that less weight through a joint is less force. So less force is going to make it feel better. So obesity is probably at the core of why people's joints hurt so much. So I tell people to lose weight first,
Mm-hmm.
particularly with an emphasis on watching their sugar intake. The more sugar that you're intaking, the more likely you're going to deal with weight gain and hunger over and over. And once people have gained so much weight and their joints hurt,
Mm-hmm.
sometimes it's very hard for them to lose weight again. And so they can do, if they can't run or bike because their joints hurt, they can do upper body exercises and build muscle, because
Mm-hmm.
muscle help them lose weight. And controlling your diet will also help lose weight. And if you can control your weight with upper body exercises and controlling your sugar, then it will help lower your weight, and so your joints will not hurt as much. After weight loss comes anti-inflammatory medications, and they're known under different names in different countries, but ultimately it's an anti-inflammatory medication that you can use to help control the pain in your joint. And that's not going to bring the cushion back, but it's just going to help control your symptoms. So sometimes people don't want to have surgery. So I tell them anti-inflammatories is the next best thing. And after
Mm-hmm.
that, there are injections. So injections, there's no injection in 2021 that's going to bring back the cartilage. People talk about all kinds of fancy injections, but there's nothing that can regenerate your cartilage. And that ultimately leaves replacement as your option. And replacement is done, it's very safe for the most part. There
Mm-hmm.
are risks, but if you're pretty healthy overall, you can have a joint replacement and go home the same day and recover within about a month or so. It's important that you do the physical therapy after this kind of surgery, because it's going to be very tough on your body if you don't do that. And so there are a variety of different ways to do hip and knee surgery, but I think for this audience,
Mm-hmm.
I think the thing to understand is there's no real way to avoid a hip and knee replacement once they have bad bone-on-bone arthritis in their joint. So this is kind of the stuff I do every day. and I take care of hip and knee replacements. And then the other question people ask me is, how often do these joints, how long do they last?
Mm-hmm.
And technology these days is so good that, it's common to last more than 30 plus years. And so the risks are relatively low, and the satisfaction is very high. The results of a hip replacement are usually better than a knee replacement. But that's
All right. Thank you, Dr. Kirat. So now we would take other question from Dr. Modha. Dr. Modha, are you there? Okay. So, doctors, please feel free to chime in. But the next question that we have is about what are the musculoskeletal symptoms in COVID-19 patients?
Yeah, this is Dr. Maheshwari, myself, and first of all, Ishita, I congratulate you for doing such an excellent program on the current problems which is prevailing over the world. And I also congratulate Dr. Prakash Modha. I think there is some voice cutting is there. Is the voice is clear?
Yeah, the voice is clear. No doubt.
Okay.
It's clear.
Okay, fine. Dr. Prakash Modha, he is also doing a wonderful job, and I congratulate him for making this program so live along with you. Friends, COVID patients are nowadays, everybody knows about COVID in detail. Even a layman knows everything about COVID in detail. But there are certain facts which are little more than what we want to know is that when the patient gets a COVID, he will be asymptomatic to the tune of the patient will be gasping and he will be in ARDS, or he will have pan-compartmental problems along with the liver, kidney, and heart involved. So this is multi-organ involvement can be the last point. So beginning is asymptomatic. So when patient comes, he got the typical problems like nasal congestion, he will have sore throat, he will have rhinorrhea, he will have fatigue, headache, he will have fever. These are the common things which we observe along with the asymptomatic patients. But if you talk about the musculoskeletal part, then musculoskeletal part is still, as symptomatically it is not explored in the world, but there are some points which I can explore, which can explain is patient may be having severe myalgia, patient can have a severe fatigability, even he can have arthralgia. But these things are not in all the patients. 25% of the patients get muscular pain and fatigability, and 15% of the patients are getting arthralgia.
Right. Thank you, Dr. Kalpesh. So yes, Dr. Modha. Yes.
Kishore.
Yeah.
Yeah, we do have an asymptomatic traumatic patient when accident happens. We don't know his status, whether he's having COVID or he don't have a COVID. We don't know. So patient comes, we do antigen test fast. It comes negative. Then we send also RT-PCR. Sometimes RT-PCR also comes negative. And patient is having COVID. So we might operate at this sort of a patient, Kalpesh, what do you say?
Yeah.
Yes, sir.
Yeah,
it's quite possible.
Yeah.
Because I have also experienced so much type of patient. When patient got trauma or maybe fall down heavy weight lifting and come to us, we screening by antigen test, it will be negative. But we do a CT test. There we see the lung involvement. There is a correct score that he has the asymptomatic, or there will be infection present in the chest, and patient is got infection from the COVID.
So doctors, there is a live listener who is watching us live. His name is Prabhu Velu, and he's asking us a question. So just to interrupt, and we are taking live questions from live listeners, which is hello all. I have a question. Is chiropractic treatment suggested for back pain? Who wants to take this?
Kirat, Kishore, take it.
One
Yeah.
of you, come on.
Yeah. In fact, chiropractic is a practice where nothing invasive. Patient will be only coming in touch with the treatment giving physiotherapist. So if the patient is having asymptomatic COVID positive, in case that is very rare, which we see. But otherwise, commonly we see that the patient has got the symptoms and he will have the fever and all these things. In those cases, if you avoid it, it's better. If you are having, say, the history of fever, or you have got any symptoms which is related to COVID in a short time before, you should avoid these things. You should take rest. But if you feel that you are absolutely normal, then you can go to the chiropractic for the treatment. But keeping in mind that even chiropractic himself is also not COVID negative. He also can also be a transmitter. So as far as possible, in this time of COVID, it is better to be in touch with unknown person, whosoever, whether it's a doctor or whether it's a chiropractic.
One more thing, I would
Okay.
like to admire. I have got a friend in New York, Kishore. Yeah, he's a very big chiropractor. Had 8 chambers of his own. He looks one after another, one after he goes to one after another. He sees almost 30-40 patients a day. And see what they do. Sometimes they do manipulation. Chiropractors, they are expert in manipulation. So some myalgic pain will go away. But sometimes if it is a disc or if osteoporosis sometimes, then patient get worse. So these are the things which I have faced, but they are expert in their field, definitely.
Here's what I tell
Okay.
them. I say, look, if somebody wants to go to a chiropractor, back pain, why not? Try it. You don't have, I mean, the COVID thing, yeah, it's a separate issue, but
Yeah.
try everything that you can before having surgery.
Okay.
Surgeon.
That's right. I think surgery is the last resort. Like when God cannot help you, you're like, hey doctor, save me now because I can't walk.
Yeah, that's right.
You see, in India, we say hard work. Kishore,
Yes.
hard work.
Yes.
They are
Facts.
it is similar to chiropractors.
What is hard?
And
What is hard weight?
hard work. Hard ka no vaid.
Oh,
There is a type of bone setter.
Gujarati terminology is a હાડકાનો વૈદ is hardware. સમજે? અને એટલે હાડકાનો doctor. Before orthopedic surgeon comes into the picture,
okay.
They used to treat all fractures by giving splints and keeping them, and they unite naturally. So they don't used to you put a plate or screw or anything. So this is called hardware. Or nowadays in US, they are modified, they have been trained, and they become chiropractors. You see?
They are qualified bone setters.
Yeah, qualified bone setter. In short, qualified bone setter. Kirat, are you agree with us?
I don't have those in the United States.
Sorry?
Wait, can you say that again?
I don't think we have those in the U.S.
The hardware.
Practitioner, no?
No.
Kirat. I have got my friend who is chiropractor in New York. Very running very high practice, very good practice. But you tell him that you are hardwired.
But they are doing good. But they are doing good job. I have come across, and they are doing good job. They set the certain types of sprains and sacroiliac problems very nicely with the manipulation. They do good manipulation, but he should be well trained. It's a two-edged sword. If you do it rightly, you can cure the problem very well. But if the problem is different, if you are not identified rightly, you are likely to increase the problem, like what it can be in the slip disc or in osteoporosis. But they do it with very, very precisely. They don't do randomly like that. They do all investigations and then they go for that.
So thank you, doctors. That was very interesting discussion. So let's take the next question. So as you know that Radio Mirchi 1310 AM is the radio station who is supporting and sponsoring the show. So one question from Radio Mirchi is, what is arthritis? Types of arthritis, symptoms, diagnosis, treatment, anything surgical?
Who will take?
I can take this one. Arthritis is just, again, bones are not supposed to touch one another. There's space between them that's filled with a cushion called cartilage. So what ends up happening is if the cartilage is damaged and there's inflammation inside the joint, that's called arthritis. It's inflammation of the joint. It usually results in damage to the joint, and bones start to touch one another, and people have pain when they walk, so when they move the joint. And again, like I said, the diagnosis is usually made on an x-ray. Okay, you can have arthritis in your wrist, you can have it in your ankle, you can have it hip or knee or anywhere you have a joint. And then the treatment, like I've already mentioned, you can start with weight loss, move to medication, move to injection, then move to surgery.
Thank you, Dr. Kirat. Yes,
I
Moda?
want to ask one question to Kirat.
Yes, yes, Dr. Moda.
Patient in US, 150 kg weight, very big patient, 6.5 foot, 7 feet height, 150 to 200 kg patient.
Oh my God.
How do you ask them to lose the weight? Is it possible when they develop fracture?
Oh man.
So, Dr. Botha, are you saying in a fracture setting or in a joint replacement setting?
Sorry, say it loudly again.
Are you referring to if a patient came in for a joint replacement?
Yeah.
That size? Yeah. The literature shows us that if you operate on folks that are that heavy, you run the risk of loosening of the implant. Okay, you run the risk of infection.
Oh.
Yeah.
And
correct.
Wound complications. So even though their joint hurts, it's probably more harm to the patient if you operate on them, because you put them down a road that may be very hard for them in the future. So, like I said earlier, they need to lose weight. There are a couple medications that people can try that, at least in the United States, the FDA has approved for weight loss, and they can build muscle in their upper body to help burn calories, and they can use a pool. They can get into aquatics.
In fact, I would like to add in arthritic matter. See, usually what happens that by birth, human being has got some virus in the leg, some virus in the tibia, and it is because of that gradually it increases with the lifestyle and the weight and the aging. Once the alignment, that virus, that the bow of the leg gets increased, it leads to degeneration, arthritic changes in the medial compartment. That is the one part of the joint. And once it starts, whether you do physiotherapy, whether you do exercise, whether you do weight loss, you will have some relief with that. But the process of getting the knee bend increases. I think you have seen so many patients, they walk like this, they waddle. They walk like the aged patient, they walk like this. These are the patients where the knee is bent and gradually it increases. When it reaches to the last stage, that is that what can say the pan-compartmental arthritis, all the parts of the joint gets wear, the Tirath comes in the action and he does the replacement. Right, Tirath, you agree with me? But I am doing something. You asked me the question, what is knee preservation surgery? Where we do what I do is, see, there is level 1, level 2, level 3. Level 1 is equal to patient who has got the early arthritis, who will be on medication, weight loss, and physical exercises and this and that. That's okay. He will get the relief. But if he goes to this level 2, where he will have relief with the medicine temporarily, even they have done all exercise and everything, the problem increases and they have to consume medicines regularly to get the relief from the pain, or they take the steroid injections in the joint, or lubricant injections in the joint. These are the level 2 patients, and once it reaches to level 3, they go for the replacement. I attack the patient in level 2. I correct the alignment, and once the alignment is corrected, the part which is getting wear will be offloaded, and the part which is spared will be used. So it increases the longevity of the knee joint. That is what I do regularly, and that is called high tibial osteotomy, HTO.
Excellent, Dr. Kishore. Excellent. Yes, Dr. Moda.
Kishore, if
Yes.
the both the knees, tibial part and the femoral part touches medially, and they produce osteophytes, do you do your knee preserving or you go for replacement?
See, the point is, it is bone to bone. What we say, it is a bone to bone. But then, if the patient has got severe varus, and on MRI and on X-ray, if you see the lateral compartment is reasonably good, then definitely I will avoid knee replacement. I will do the alignment correction. And if you see later the degeneration which is there on the medial side, you feel like it is healing. That is what you can observe on the serial X-rays taken later. And also the osteophytes which are formed get gradually reduced. So it is possible. It is possible even in the bone on bone, but subject to the lateral compartment where you are going to put your weight is good. Good in the sense of MRI and in the sense of the X-rays.
Yeah.
Interesting.
Now it's Kalpe's turn.
Yes, Dr. Kalpesh. Let's hear from you about. There is a question which is very common that we get, which is it true that after taking vaccine, let's assume that the patient is a senior citizen, he becomes weak, and if the patient is already immunocompromised, is patient more likely to opt for knee and hip surgeries? Is that true?
No, if patient is immunocompromised, then we should to stop the major surgery like hip and knee. And after vaccination, there is a weakness in the seniors. It's about a couple of days, about 1 to 2 days. After that, simple taking paracetamol, patient will be improved, and there is a no weakness. But patient if he is immunocompromised, so there will be less immunity in their bodies. If we are going at some operative surgery like hip and knee or any spine surgery and doing for implantation, then there is a very high chance of the infection. First of all, if we are going for any surgery, we have to calculate the risk. What is the benefit of the surgery? What is the risk of surgery? And how patient is complain of the disease. If he cannot walk, he cannot do any daily activity, then we are going to do surgery hip and knee. So he can get a better chance and better rehabilitation after the surgery and uses daily activity within good lifestyle.
Any comments, doctors, on this? What do you guys think? Any further discussions? Dr. Moja, we can't hear you. Can you? Yeah, now we can. Yes, you are on mute. Go ahead.
Kishore, tell Kirat or Kishore comment about it.
Yeah.
Yeah, I agree with Dr. Bajania. What he says that, when the patient is immunocompromised, I think when the patient is immunocompromised, preferably no surgery should be done except it's in dire emergency. Knee and hip replacements are not dire emergencies. They can be treated conservatively till patient gets the real immunocompromised state back to normal. Because you can treat them you can put this category into elective surgery whenever patient is comfortable then and then. Otherwise, chances of infections are very high, and instead of getting benefit, patient may be having a lot of problems thereafter. So it is better to avoid surgeries, particularly those which are not real emergency. One should not opt for any surgery, including hip and knee.
Excellent, doctors.
Where is Kirat?
Yeah,
I'm-
Dr. Kirat, are you there with us?
I'm still here. I'm on call, so I'm having to respond to cases as they go. So, guys, unfortunately, I've only got a couple more minutes with the group because I've got a couple cases to do tomorrow.
Sure.
But, I'm happy to stick around and see if I can help in any way.
Mm-hmm.
Kirat,
Sure.
one more question I want to ask you. Suppose patient is having HIV.
Yeah.
What precaution do you take during the surgery of a hip or knee replacement?
That's a good question. Nowadays, HIV is readily treated. It's treated pretty well. And so, if their viral load is low and their CD4 count is appropriate, I don't take any additional precaution. Overall, they're pretty healthy, and I don't do anything different. If somebody has AIDS, the CD4 count drops low, that patient is automatically just not healthy enough to have a joint replacement, and therefore they're not a candidate. But HIV by itself, it well controlled. The outcomes are the same. Would you do anything different?
Doctors?
So,
Yes, in any condition like HIV, AIDS, there we in any surgery we should to follow the universal precaution. So we can there is very less chance to infect us and our staff go assist in our
yeah.
surgery. Yeah, we should always keep a universal precaution doing surgery in such kind of patient. And also one thing is to elaborate that. Previously, Michita, you asked in HIV or AIDS, there will always be immunocompromise will be there. So
Yeah.
first, we should to improve their immunity by diet, heavy protein diets, and after every investigation, first of all, we should to do every culture like blood culture, urine culture, tracheal
Mm-hmm.
culture. There is any infection in the body, and then we have further go for the surgery. Even after surgery, we put in a higher antibiotic and also there will no any fever or any simple analgesic inflammation reaction in their body. So call to us so we can battle that as early as possible and we give a perfect result to their surgery.
Now, next question goes to Kirat.
Dr. Moda, why don't you ask? You are asking excellent questions, I guess.
So you ask Kirat. I will
Okay.
add if something requires.
Okay. So next question is Dr. Kirat is performing this different surgery. So I would just like to share screen. He wants to talk about the surgeries he has been doing. So I just share my screen. Dr. Kirat, you ready to talk about
Yeah.
your?
I'm
Okay.
ready. So-
Guys, you can see my screen.
Yeah.
Right. So ultimately, let's go to the next one.
Okay. Mm-hmm.
Right. So I don't know if you guys can really tell here, but maybe let's go to the next one.
Okay.
You can see that that's a hip joint. The
Mm-hmm.
bone down low is the bone of the thigh. It's the femur, and it's supposed to be a ball up top, and it sits in a socket. It's a ball that sits in a socket, and in this patient, it's pretty worn out. So if you go to the next screen, what we essentially do in surgery is we cut out all of that arthritis out and then replace the femur, make a new ball, and she gets a new socket up top with a screw. And this individual gets a new hip replacement like that. So they can have a artificial hip that functions really well and has good range of motion. The next one is a knee. So this knee, like the other team was talking about, you have bone on bone on one side, and what you end up doing, if you go to the next slide, that's from the side view. You can see that the kneecap, which is in the front right there, you can see that there's some space. There's very little space between that and the rest of the other bone. when that happens, the patient is usually a candidate for a replacement. So if we go to the next one, and so this is replaced. So now the bones are separated because we've shaved the edges of the bone off and put metal on both sides. And if you go to one more, that is a replaced knee. So that'll keep the bones from touching one another. So all the white stuff is metal.
All right. So yeah, but Dr. Kirat, there is an interesting question that I have for all of you. How do we do surgeries with robots?
Yeah,
You know,
robots make all the cuts that we make normally, but the robot will then plan it, and based on a CT scan done before the surgery, you can bring the robot in, and essentially, instead of you making the cut just on with your eyes, you can just have the robot make a more precise cut. But the outcomes with robot surgery versus doing it manually, are the same. So there's no real advantage, I don't think, at least not right now, for marketing than anything.
I see. So doctors, what do you think? This robot surgeries, artificial intelligence, this is all booming, in Bay Area right now. That, Neuralink, Elon Musk, everything. But Dr. Kirat is saying that, hey, it doesn't really matter. It's the same. It doesn't make much difference. Whether you cut the bone with the hand or you perform the surgery with the hand versus the robot doing the surgery. So maybe we can just a little bit discuss about what is all this going on with the robot surgeries. How is it in
Kishore.
India?
Yeah, actually, India we have a robot. Kishore will tell you. And
Yeah.
Ajanya will be able to tell you better.
The robot surgery, as Dr. Tirath has rightly said, that it has come in certain parts of orthopedics, but not in all parts of the orthopedics so far. But it has come definitely in, in the abdominal area, and for the prosthetic surgery and for the removal of the gallbladder and those areas, these robotic surgeries are going to be fantastic. The console is somewhere, and the instruments are in the abdomen of the patient. The console is somewhere, and the eyes of the robot are on the knee joint, and they take the precise. They are very precise. They are very particular, and one can see and one can perform the surgery. As Dr. Tirath says, that while the robot is doing very precise cuts, but it has not been accepted much in orthopedics. But robot is very well accepted in abdominal surgery, for the prosthetic surgery, definitely, where the results are excellent, because whatever you see is magnified. Whatever you cut, the things which you can't see with your naked eyes, you can see with that, and you can do the surgery perfect. So the robot is definitely very helpful in orthopedic, in the medical practice. But per se in orthopedics, it is not that great advantage still we have received. But things are coming up. With the AI, the things will come up, and there are chances that reduction and all this preparation can be done in advance for the fractures, and one can get the best results.
Dr. Bajania and Dr. Modha, yeah, please, any comments? Yes, Dr. Modha.
See, robotic surgery is just to attract the patients and common man's attention. Yeah, we got a robot like this, and we do surgery, but the outcome, as Kirat has mentioned, that outcome is same. But
Same.
when you get a new instruments, people say, "Oh, this is very good. Let me go there." So you attract the patients, you attract and more, get a more business. This is one of the trick of the tricks. Really, Kirat, do you agree with me or not?
Yeah, I 100% agree. I think the outcomes are the same, and a lot of this is just more marketing pressure.
Oh.
So.
But one point is that this is what is in orthopedics. I agree. That in orthopedics, yes, it doesn't make difference. If you are a good knowledgeable surgeon, if you got a good experience, you don't need any robot.
Yeah.
Yeah.
But in abdominal surgery, where the things are,
Yeah,
say
good.
for example, when the prostate is there, if you do naked eye, you can damage so many things around. And in particularly when the patient has got the early stage of malignancy, then robot is one which can take the samples needed, which can do the job, which can do the excavation very nicely. So different field, different impact of the robot, but orthopedics per se, at present, it is not of much advantage.
Right.
Hmm.
Yeah, I agree with you. But it is good for prosthetic surgery, I
Yes,
must say.
absolutely. Yeah,
And they can remove a small tiny piece of the
yeah,
cancer in the prostate
absolutely.
easily, and that is a minimum invasive surgery for
Yeah,
prostate. So
yeah,
robot is good for the prostate. So far I know,
yeah,
but I'm so far not expert.
yeah.
So while we are discussing this, I just want to make a comment. Whoever is watching us live, a bunch of you guys, right? A bunch of you are watching us live. You can just type comments. जे तमे Facebook में type करो छो, right? All you have to do is Facebook पे जाइए, comments type कीजिए, and we gonna get it right away, and we gonna reply right away. मतलब कि हम आपको अभी तत्काल में आंसर दे सकते हैं live वर्ल्ड के कोई भी कोने से,
Corners.
right? So please let us know any questions, and yeah, I'll let Dr. Modha continue what he was talking about. Dr. Modha.
Yeah. So robot is important as far as I know for the prosthetic surgery.
Okay.
But even robot has come in spine surgery also.
Wow.
Yeah. But still, we are not accustomed with the robot. Whether it is helpful or not, I will not be able to tell you. But there are things. But we have got a neuro navigation, which is important for brain as well as for the spine. Kalpesh.
Yeah.
Yes, sir. It's neuro navigation and spine navigation. Now in the conduction.
Dr. Kapesh. First, tell us what is neuro navigation. What does that mean? Audience would not know that, right?
Yes, there is during surgery we put electron nodes in the body.
Okay.
So during doing some spine surgery, complicated spine surgery, there will be a, scoliosis, kyphoscoliosis, in where there will be a there is a no normal anatomical vertebra is there. So very good chances of the we can damage the nerve roots, and so patient can in future there will be a neurodeficiency. To avoid this complication, first before doing surgery we put the electrodes in various part of our bodies.
Okay.
So if any metal will touch the spinal cord nerve roots, the it's a machine can say we can and there will be electric waves, so we can direct that we can damage or we can very near to nerve roots. So we should change our direction of the screw, so we can avoid the damage to nerve roots. And so there will a post-op, there is a non-neurological deficiency to this patient and give a better results. It's a power of neuromonitoring. That's by that we can give a better results and very less complication about upper limb or lower limb weakness or bowel bladder dysfunction. We can avoid by this newer system on in neuro navigation. And also in case it is used in the brain surgery, this will be most give answer by the Dr. Mota sir. It is very much can we can do AVEC brain surgery due to navigation scheme, and also during intraspinal nerve tumor removal. There will be very much helpful, so we can avoid the damage the intradural nerve tissue, and so we can give a better results and very good removing of the tumor from the spinal cord.
Gentlemen, at this point, I'm going to have to leave you. It's almost 10:36 my time. Couple cases.
Yeah. Can you be a little louder?
I said at this point, I'm going to have to leave the show. It's very late on the East Coast. I have a couple surgeries in the morning.
Yeah.
So,
Yeah, we understand, Dr. Kirat. And do you want to share any last message?
It's a
What are
pleasure
you
meeting everybody. I think we're always here to help. So thank you guys for everything.
Thank you.
Thank you.
Thank you.
We'll see
Thank
you
you.
sometime.
Bye bye.
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 Okay, so we were discussing neuro
Navigation.
Monitoring.
navigation,
Yeah.
yes. Like, I only know Google Map navigation. I don't know neuro
It's a
navigation. I'm
similar thing. It is
fascinated.
similar thing. It is
Similar?
Yeah.
Okay.
It directs us
So you map the
during
thing.
Sunday.
Suppose brain tumor is there.
Huh.
So previously, it was very difficult when we were without navigation,
Hmm.
just on the basis of CT scan
Hmm.
or basis with the X-rays. Sometimes our incision comes here, then we have to cut the extra bone. We have to go here. But with the neuro navigation, you can exactly locate the tumor which is here, suppose, and then you can take a flap. So it is a minimum body involvement we can avoid, and we can do with a minimum bone work. So precise bone work will get you there on the tumor. And another thing Kalpesh mentioned, that with the electrode monitoring, we can preserve, suppose we are working with the facial now.
Mm-hmm.
So if we have got a monitoring, we go near the facial nerve, there will be a noise, and whatever the graph will show that you are near the nerve. So we can preserve the nerve as well.
Nerves.
Similar thing for the spine. If we are near the spinal nerve, it will give us a big change in the graph and some noises that you are near the nerve. So please go away, and we will be able to preserve the nerve. So this is the importance of neuro electro monitoring as well as neuro navigation.
Excellent, excellent. I didn't know. Okay, India is also advanced with robotic surgeries, with all this AI.
Everything.
No. It is right there. And even
Uh-huh.
even I tell you in the knee preservation, I told you about the knee preservation surgery, right?
Yes, doctor.
Dr. Tirath said about that they use this navigation and this monitoring robotic surgery in the knee replacement. Even we have now started using it for the knee preservation surgery. We preserve the knee. See, this is something else. If something is rotten, you change. But if something is going to be rotten, you can prevent it. There is no need that you should. There is no need to wait that you get it complete and then we'll change it. So before that, if you intervene, you can save the knee joint, which is your natural. And natural knee, if you can preserve, it is better than anything else. Replacement has got its own problems. It doesn't mean that once you replace, everything is fine. It is going to be fine. There are patients who will get the problem. There are patients who will get the infection. There are patients who will get the loosening. There are patients who will be having problems, persistent pain. In spite of everything is done fine, still patient will say, I am not comfortable.
Oh.
Patient will have restricted knee movement. They can't do complete movements of the knee joint. So it is not the panacea that you do knee replacement, everything is done. So original knee, if the God has given you original knee, why you should replace? So if you do knee preservation surgery in time, you will never require replacement in future. So this is what is one should think about. And in India now, which is very much upcoming, high tibial osteotomy is upcoming, and there are so many symposiums and so many workshops, so many conferences done on high tibial osteotomy.
Wow.
And
excellent.
and Ishita, you will be surprised, and you may be happy to know that I have done highest number of surgery in knee preservation, high tibial osteotomy in the country. And this is all
Yes, very good.
and this is all documented.
Wow.
This is documented. And I am one of the faculty in so many conferences, and this is I am doing since last 32 years. These are 32 years I'm doing it.
Excellent, sir. Excellent.
And not to boast about, but this is the truth, and I can produce the results. I can produce the patients which has been documented, and it is one of the best procedure. And particularly in the country like India, where patient needs to sit on the floor, patient need to squat on the floor. We don't have facility that patient will be sitting on the chair. He will be working in the factory, sitting on the chair. We have got all the facility. If I want to earn my livelihood, I have to work in the field,
in the farm.
in the farm.
There are
No,
farmers, right? Farmers बिचारा जे I mean I feel very bad about them कारण कि पछु tractor तो होय but they have to do a lot of labor work and they
Labor
need
work.
strong knees.
yes.
They
He
need
needs it. He
right
needs real knee.
really
Naturally.
And if the real
Yeah.
knee is there, he can do anything, whatever.
anything.
So in our country,
Huh.
and Western country, there are different. In Western country,
Yes.
they don't have to do labor, high labor.
Oh.
They don't have to sit. They don't have to do anything which is more laborious. In
Sir,
our country, everything is like that. So we preserve the knee and we do the job.
I'll tell you since we are in this labor and we are comparing.
Congrats to Kishore.
Yeah, congrats,
Thank you.
Dr.
And we are
Kishore.
proud of you. So,
Thank you.
Yes.
Thank
keep
you.
it up.
So I want to make one comment here. When you talk about labor in this country, I call a plumber here to fix something at my house. He's gonna charge me $75 for an hour. That's
Mhm.
and now I'll tell you a software engineer who has freshly graduated with bachelor's degree is also getting paid $75 per hour in a software company. So here the labor cost is equivalent to computer science degree. You know, I feel like what man? What
No,
is
no,
this
Mirchit,
labor? Uh-huh.
no, Mirchit, I also commented in someday before, one person who come for the pipe fitting in the
More
US.
Kalpesh.
One labor person come in the pipe fitting in the USA. Their
Hmm.
charges around $3,000 for 1 hour. It's come in the news also only.
You know, so labor ની તો આપણે વાત શું કરે our farmers are like, you know, બિચારાને 50 રૂપિયા ના મળતા હોય કે સાહેબ 50 રૂપિયા આપી દો ઓલા કામવાળા બેન આવે તો કે બેન 100 રૂપિયા આપો આજ ના I feel like oh my god, like see the country, both countries and the difference between developed country and developing country, right? It's
So
quite huge.
that's why Ishita, I said that every country has got different requirement,
Yes,
and the surgeon should not follow the things which are done in Western country where the facilities are like that.
exactly.
We have to create our own requirement and facility for the because 80% of the population 80% of the population is living in the village. 80%. Now, if I do replacement, for example, if I do replacement,
Hmm.
I can do it. It's not a big deal.
Hmm.
Replacement surgery is nowadays done in India is in and out. It's okay. Now, if I do the replacement, patient will be told first, don't do squatting, don't sit cross-legged.
Hmm.
Now, if he'll not sit on the ground, how he will do the work? If he'll not do the work, how will he have a livelihood? So replacement is equal to making him useless,
Disable actually.
disabled. So knee replacement is not entertained much in country. One should think about the preservation, and this knee preservation works for the life, and they can be without any pain with original knee.
Excellent, Dr. Kishore. Excellent. Dr. Modha, you had some comments, so let's take that.
Yeah. Kishore is doing since a long this thing,
Mhm.
and I have seen his good results. So I agree with Kishore. And country like India,
Hmm.
we are more for preservation because in US, what is see actually Kishore, I will use the Marwadi brain now.
Uh-oh.
For US, actually what they are money oriented, company oriented, implant oriented things. So I replace
Yeah.
kari diyo. So
Yeah.
replace will orthopedic company will earn, and
Hmm.
whatever the things surgeon
Insurance.
will also earn, and everybody earns. But in reality, this is a gimmick. What I feel,
Yeah.
this is my personal opinion. I may be wrong, but that for earning and for making this, because they don't come across our situation. કે ભાઈ પલોઠી વાળીને
Yeah.
બેસવું છે કે ઉભડક બેહવું છે, so that is very difficult with the knee replaced for a knee replaced person. But
Hmm.
if you do preserving surgery, knee preserving surgery, then you can sit, squat, you
Yeah.
can
Freely.
and you can work hard, and this is relatively smaller operation
Hmm.
than
Yeah.
the knee
Replacement.
Yeah.
ના ના એક્સિલન્ટ અને આઈ સી અ લોટ ઓફ farmers આપણો તો દેશ જેને કહેવાય ને ખેતીવાડી ખેતી પ્રધાન દેશ છે આઈ વુડ સે
Yeah.
બરાબર
Yeah.
ને we are land our country is a land India is a land of agricultural
Agriculture.
country right
Yeah.
peninsula so I would say that and atyare I mean I should not say this but there is this whole protest going on with farmers I feel so bad that they are suffering right now with what not right
No, half of the thing is political. Half of the things.
Yeah. Actually,
farmer protest is political. So
Yeah,
we
it is
don't
basi-
entertain that part also.
yeah. Basically it is in benefit of the farmers, but they are being manipulated in such a way that they feel that they will not be having benefits. So that's why it is, as Prakash said, it is more of a political.
Right. My dad has posted a message. I think he's watching us live and he's saying that I'm
Yeah.
proud of
Blah blah blah. Da, blah, blah, blah.
proud of my daughter and all doctors who spends time and thanks to Dr. Modha to help Ishita. Thanks every doctors to give this type of program. Mahesh Tanke and family. So and then he also said very nice Dr. Kishore for good advice. પણ આપણે તો ડિસ્કશન કરતા રહેશું બટ લેટ્સ ટેક ધ નેક્સ્ટ ક્વેશ્ચન ગાઈઝ વિચ ઇઝ ડોક્ટર્સ વિચ ઇઝ what is the role of orthopedic surgeon in COVID-19 time? એ બહુ important question છે, right?
Hmm. Yeah, the basically the role of orthopedics, orthopedics is a very vast subject, but definitely in this time, patient will have orthopedic problems. Now, the orthopedic problems can be in two parts. One part is where avoidable. If I get the knee pain, if I get the back pain, if I get the neck pain, it is avoidable. Where I can manage myself with the what we say gargathu ilaj thi. I can manage, and I should not go to the doctor. But if I get the acute pain, severe pain, in that case I have to go to doctor. The other part is the injuries, where you get the injury, accidental injury, you get the trauma, you get the cuts, or you can have even assaulted injuries. Like in those injuries where the fractures are there or the bleeding is there, then in that case you have to go to the hospital. Now, when patient comes to the hospital, the doctor is not aware about whether this patient is COVID positive or not. So the responsibility goes on either part, the doctor and the staff. The responsibility of the doctor and the organizers is that they have to see that the environment is safe for the patient. If patient comes, if he is normal, but the staff is having COVID-19, then there are chances that instead of getting better treatment, he will get the problem. So it's a very big subject, but to be on this either side, the precautions has to be taken in practice for the patient's management as well as for the doctor and the staff to be kept in order to avoid the contamination and then treat the patient in orthopedics.
Any comments, Dr. Modha or Dr. Kalpesh?
Kalpesh.
No. Sir said absolutely right, because there will be very good chance of contamination by us also, from patient also. I just tell about my experience couple of days before. One of the my patient go to home. He fell down, we slipped down. Come to our hospital. There is a deformity in upper limbs. There is a severe pain, crying. I just examine and do X-ray. X-ray shows there is a fracture of the radiation of both bones. After that, I do a rapid antigen test, and that it shows the COVID positive. That's why we do tell the patients, and there will be a very big task to explain the patient, because he has come to us for treatment of the fracture, pain in the limbs. You are saying that I am now COVID positive. I have no symptom. I have no fever, no cough, no loss of smell, nothing, no myalgia. But I have only a pain. There will be a big task, and then we argue said, yes, you have no pain, no symptom, but the report says you are COVID positive. Because of that, you have less infection, less viral load, so you have and get better immunity. So you have less complaint of COVID-19, but you are a COVID positive patient. So you should treat first the COVID positive, then and after you cure from this, we do a surgery of fracture fixation. We give a spleen, give a medication. After 4 to 5 days, we redo the test. If it's come negative, then we do surgery, because it is only a deformity and pain. It will be subside and we can cure after some time. It's a not a it's an emergency pain. If pain will subside, the patient will be happy and do surgery after some time. But if there is a vascular injury in the same patient, if there is a bleeding present, then we can also do operate in same COVID positive and day one also, but with precaution.
Sure, Dr. Kalpesh. So I think in interest of time, we will keep maybe like last 1 or 2 questions, right, Dr. Moda? Or
Yes,
any
yes,
comments?
yes.
Yeah. So the last
Actually,
question
You carry on, carry on. We should finish now. It's too much time.
too much time. I know. I'm sorry, doctors, but this is very,
But
very
interesting
important.
people.
But before
Important
I
and
close,
interesting. See, Kishore's things is into. Tell
Excellent.
Kishore.
Yeah.
the question you asked was what about the orthopedics?
Yes.
Patient comes and goes because the things are moving, but because of the lockdown, less work in the factory, less movements on the roads, the shops are closed. So what happens? The movements are less, but domestic injuries are still bound to happen,
Hmm.
and even assault injuries are likely to be. So
Hmm.
when patient comes to us, we put them into 3 category. One is emergent,
Hmm.
one is emergency, and
Mhm.
one is conservatively manageable. So
Okay.
emergent is one where as Kalpesh, as Dr. Bajania says, that they have got the bleeding, they have got crush injuries. These are the patients you have to attend, whether you don't have even time to investigate whether they are COVID positive, they are not COVID positive. So you have to finish it, the surgery in emergency with no protocol. You have to just head with the surgery. You have to save the patient. The next category is emergency, where patient has got a fracture. Now this fracture, whether it is in the hip joint or whether it is in the forearm bones or in the humerus, these fractures you can put them into conservative. So if it is possible to make them in conservative, leave them. Investigate, complete, thoroughly checkup done, and after you feel that they are safe to be done, you do it. If you feel a little doubt, avoid it. Put them on the plaster for few days,
Hmm.
and then reinvestigate and do it. So emergency, and routine. Where if I got a knee
I
pain
see.
or back pain, I ask them to go home, and then you can take medicines and you can avoid the surgery in those cases. So orthopedic surgery is something where the things can be managed like this.
Right. Excellent, Dr. Kishore. So, without taking a lot of time, just take very important question I remember from Radio Mirchi, which is how can we bring more awareness in people so that they approach doctors for surgeries and not get scared and wait till last minute for emergency surgeries? Last question of our show.
Should I answer for this?
I,
Yeah.
I, up to you, doctors. Who
Kalpesh.
wants to take it?
Yes. Maheshwar sir can go.
Okay.
Okay. Yeah. The question is that awareness about the surgeries. Everything is already being discussed about this thing, that if you get something which is avoidable, better not to go to the hospital.
Mhm.
You can do telemedicine, you can do telephone call, you can send emails. With that you can consult the doctor and you can get the treatment. Now if the doctor says that you need further investigation, the problem is not solvable like only with the telemedicine. You go to the hospital, get the investigations done. Now doctor will take the call. If doctor says this is emergency, in that case you agree, you don't worry for that, because doctor will take enough precautions that he will not get problem, you will not get problem. So there is no need to worry on the side of surgery when the doctor says that you need it and you have to go through. If emergency is there, you get it. But if the doctor says you can be treated at home with the conservative management, you get the treatment like that. So if doctor it's the permission of the doctor. If he says you need surgery, you should not worry. You should take all the words, because doctor himself is also worrying that he also should not get, his staff also should not get, and his patient should be fine. So there is not much of worry in this COVID time. Everything is not bad. Things are bad in the sense if it is not done properly. But the good doctor will always take care of you. So nothing to worry on the surgery side. If it is necessary, if it is emergency, if doctor says, do it.
Thank you. Dr. Bajania, any comments?
Yes, truly, sir, said by the Maheshwari sir. Okay, if we are avoidable, we can wait for the condition settle out, and if there is any complication, if is any trauma, and like inside about the spine trauma, in the spine acute disc, there is a neurological worsening. Patient cannot walk with support. There will be a neurological bowel bladder involvement, foot drop. If this type of the complaint, there we cannot wait for the conservative management. We should operate as early as possible. Otherwise, if we are not handling with this type of complaint, patient have a lifetime neurological deficiency. So he can he or she can having foot drop with a bowel bladder dysfunction. He maybe get limping gait, and that may be cumbersome for whole life. So we should manage it like that. It is can wait for some time, or can handle with the conservative management by medicine or anything else, plain anything else, or physiotherapy. If we cannot wait, and there will be more complaint, when a patient cannot live their daily activities with pain, so we should do surgery as possible as early.
Thank you, Dr. Bajania. Thank you, Dr. Kishore and Dr. Modha. I'll come back to you now. Currently, we have to wrap up our show. And the last question I have is, who is coming tomorrow?
See, tomorrow actually we are.
Hello, Dr. Modha.
Sorry, charging malaga to kore.
Dr. Modha, are you there?
I think he's disconnected.
Disconnected, or maybe his. Oh, he is back.
Yeah,
Dr.
he's
Modha.
back, yeah.
So I will be talking to Dr. Rajya Guru. If he agrees, then
Okay.
we will involve him COVID and pain management. He is
Okay.
a very good doctor and my friend who is in Orlando.
Okay.
And, I'll request him. If we cannot speak, then I will arrange a doctor from Rajkot. So
Okay,
it's
sir.
not 100% sure. Because
Sure,
he is
sure.
resident, I was not able to telephone yesterday. I tried, but I could not get him. So tomorrow is the pain and COVID.
Okay,
Whoever
pain
places
and
the
COVID. Yeah, whoever doctor is available, we will get. But I must say that the doctors that we are bringing on the show are like world famous doctors, right? Everyone is specialized in their own area. Yeah, yeah, yeah.
You know that?
And Dr. Kalpesh is also into the
Kalpesh is
spine
double
surgery.
Kalpesh,
Yeah,
ortho and spine, and
spine.
microspine.
Oh my God.
He's, that sort of a man. So both are very important.
Both, yeah.
are good doctors, and both are my friends, and
Yeah.
I'm proud of them.
Excellent, excellent. I am very thankful. Currently, in spite of busy schedule, I mean, I know you all have on call. There are patients waiting. One doctor is saying, "I am coming out of the OR for your show." It's like mind blowing. Hats off to you. You guys are real heroes in COVID-19. So thank you. We will continue the show. કાલે તમે આવજો બધા 9:30 અમેરિકા ટાઈમ એટલે કે પેસિફિક કેલિફોર્નિયા ટાઈમ અને ઇન્ડિયામાં એઝ યુઝ્યુઅલ 10 9 o'clock.
9 o'clock.
Okay. All right.
Okay.
Thank you. Bye, everyone. Thank you so much.
Thank you.
Thank you. Thank
Thank
you.
you,
Bye.
sir.
Kalpesh.
Thank you.
Thank you.
Thank you.
Thank you, Ishita. Thank you, Ishita. Thank you, Dr. Prakash.
During COVID
Thank you,
time.
Dr.
Thank you,
Bajania.
Maheshwari.